Everyone, my name is Lekon Ajijola and I work with John Hopkins Center for Communication Programs in Nigeria on the Challenge Initiative, TCI. I'll be taking you through TCI's innovative reflection and action tool to improve self-reliance and effectiveness, which we popularly call the RACE tool, and how we have used the tool to improve government responsiveness to reproductive health and family planning interventions in Nigeria. TCI is implemented globally by Bill and Melinda Gates Institute for Population and Reproductive Health, and in Nigeria by John Hopkins Center for Communications Program. The goal of TCI is to support local governments to achieve greater self-reliance in scaling up family planning and adolescent and youth sexual and reproductive health high-impact interventions, leading to sustained improvements in urban health systems, as well as increasing the use of modern contraception. In TCI, we provide coaching and technical assistance to local governments for them to rapidly and sustainably scale up reproductive health programs, and this we do in 11 countries and across 5 regional hubs. That includes Nigeria. So far, we've partnered with 14 states, and 5 of these states have just graduated from the program, having achieved self-reliance. So how did we identify areas for testing using responses feedback? We basically considered the key elements of the TCI program. We considered our goal and theory of change of increasing access to modern contraception, as well as our program design assumption of having a government-led and government-driven programs. Key questions around these elements were then articulated on our learning agenda. Available evidence also suggests that government ownership and sustainability of health programs remains an issue, and all of these form the basis for which we identified areas for testing using responsive feedback. For TCI to achieve its goal, we needed to use responsive feedback to make prompt course corrections, thereby reducing the risk of strategic and programmatic gaps in programming. The RACE tool is a management and organizational tool for measuring cities towards local government self-reliance. Its structured and participatory process allows local government to self-assess their program, track progress, and make smarter decisions in the course of the program. There are 4 pillars on the tool measuring local government self-reliance. The first pillar looks at political and financial commitment. The second pillar focuses on government's capacity. The third pillar looks at institutionalization of proven approaches, while the fourth pillar focuses on sustained demand. Relevant government stakeholders make up RACE participants, and that includes the policymakers, the program managers, and also the TCI team and other implementing partners providing support for the assessment. There are 4 levels of scoring for the RACE assessment. We have the beginning stage with less than 55% score, which depicts local government with low level of capacity. The developing stage for a score of 55 to 69%, depicting basic level of capacity. We have the expanding stage for a score of 70 to 84%, depicting moderate level of local government capacity. And finally, the mature stage with over 85% score, depicting high level of government capacity. How did we use the RACE tool for responsive feedback? The first thing we did was to use a multi-stage approach for quarterly assessments, with initial individual assessments followed by small group reviews, and then final consensus on scoring based on available evidence. The TCI team and local government counterparts from the state ministries of health and the primary healthcare development agencies also interpreted the findings and analyzed the scores. They developed action plans to address identified gaps with technical assistance from TCI. They also identified responsible persons for the plans and facilitated implementation of planned actions. It's important to highlight that the assessment team referred to existing government data to corroborate scores assigned to the indicators. For instance, they used the HMIS data for client volume and also reporting rates assessments. They used project records and reports to measure scale-up and diffusion, and they used budget tracking reports to measure financial commitment and spendings. RACE findings and feedback then provided to extended reproductive health team. These they do through dissemination during the reproductive health technical working group meetings, and also during the contraceptive technology update for policymakers and technocrats. We developed a national RACE dashboard to track government's progress towards self-reliance and make prompt decisions for program improvements. So what were our findings? The assessments revealed that government systems and processes for program sustainability was generally at a basic level of capacity. 10 states have completed 4 rounds of assessment so far. with the initial assessment revealing a mature program for one of the states, a developing program for 6 states, and an expanding program for the remaining 3 states. The table above is a sample raised action plan, and you will see how the state identified lack of funding for SBC interventions as a gap, how they planned advocacy visits to key decision makers to secure funding, and how they included SBC interventions on their health plans. They also identified data issues and they planned coaching for data officers on data validation and data quality. As part of efforts to improve our program using responsive feedback, we've had to make some program adjustments based on the raised findings. We provided coaching and technical assistance to governments to integrate SBC interventions into their state program designs and operational plans so that they may ensure funding. We also engaged and coached local government program managers to be able to scale up high-impact interventions. And we provided technical assistance for the use of feedback and data outcomes to prioritize interventions. This has helped the states to be able to prioritize voluntary mobilization and facility enriches as best practice interventions contributing to increasing demand and access to services. We implemented exchange learning programs for newer geographies to visit self-reliance geographies so that they may learn effective strategies for seamless program implementation. We also have recently put measures in place for graduated states to continue to implement race assessments after the exit of TCI from their states. So what are the improvements that we have seen so far? The chart above summarizes the progress that we have made across 10 supported geographies that we analyzed. 7 of these geographies have reached program maturity, while the remaining 3 states, Abia, Nasarawa, and Taraba states, are at the expanding stage of the program, gradually moving towards maturity. We have recorded notable achievements as a result of the use of the RACE tool as a responsive feedback tool. Government funding for family planning and SBC interventions have increased. Their capacity to lead and facilitate implementation of high-impact interventions have improved. They have also adopted and scaled up interventions to more local government areas within their geographies. They have been able to report improved reporting on DHIS and better use of data for decision making. The RACE tool really has proven useful as a reflective and responsive tool for enhancing government leadership and management of their programs in the states. It is interesting to note also that most of the states have begun to review the tool for adaptive management of other health programs. Thank you for listening.